You are watching McLaren Port Huron Today's Health Program, and I'm speaking with Dr. Neal Bhatt, a radiation oncologist at the Karmanos Cancer Institute at McLaren Port Huron, about all the technology that we offer to our patients undergoing radiation therapy treatment for cancer. So thanks so much for joining us again today. So tell me a little bit how you individualize the plan for each patient.
Sure. Kind of like we spoke a little bit about in the last segment, there really is a lot to how we decide what the best course of radiation therapy is. Now, the reality is when it comes to a new diagnosis of cancer, it's not just myself making those decisions. It's actually a combined team of not only physicians, but physician extenders as well. So for the vast majority of all cases that come across our door, it's in conjunction with myself, medical oncologists, surgeons, whether they be breast surgeons or urologists or thoracic surgeons, our lung doctors. All of us tend to come together to make a decision in terms of what we think is best under different circumstances. Now, when we go ahead and personalize treatment, the vast majority of the time it happens based on national guidelines. Now, every year, physicians from all over the world come together and they produce something called the NCCN, the National Cancer Network Guidelines. And all of that is based on large research studies that are being conducted throughout the world at any given time. And what they do is they go ahead and differentiate patients' cancer stages and circumstances and give us some evidence and guidance in terms of what makes the most sense to do. That's kind of how we generalize and specify from a very broad sense. Mm-hmm. But even more importantly than that, anytime a patient comes to our door, the way we determine the radiation course and how the radiation is aimed is based on their individual studies. So what we do is when they walk through the door and when we decide that they do need radiation treatment, we actually have them get a very specialized type of CAT scan right there in our department. We then take that CAT scan and we take other studies that they've had. PET scans that were done previously, MRIs that were done, other special types of CAT scans that were used, and we take our computer software, take those scans that were previously done, as well as the brand new scan that we do in our department, and we combine them all. We then sit on the computer and we actually draw on where we want the radiation to go and also those places we want it to avoid. So for instance, when it comes to a lung cancer, we draw out the lung cancer itself, the lymph nodes in the chest that may or may not be involved, the heart, all of your good lung, your spinal cord, your esophagus, and a lot of other normal structures. And we tell the computer we want to put the radiation in one area and avoid all those places we don't.
That's amazing. So when you say we, who are the other people that are involved in this care team?
There are actually a lot of people that are involved in our care team. So even if you only meet me as your radiation oncologist, the first thing we do is after our decisions are made and the plan is created, we actually take a look at it behind the scenes. So me and my 3 partners look at every single radiation plan that comes through the door, make sure we all agree with what's being done before the patient starts treatment. In addition, when it comes to actually creating that plan, we have what's called a dosimetrist. It's their specialty to take the drawings that I've done, as well as some of the instructions that I've given and some of the national guidelines in terms of where we want radiation dose. And they work on the computer with the software to make sure everything we want to happen happens perfectly. And sometimes that involves aiming certain beams in different directions. Sometimes that involves modifying what the computer software wants to do. It is an intensive process on their end that they often spend many hours working on. After they've come together with that plan, and me and my physician colleagues have agreed that it's the best plan of action, we actually have a physicist that does a whole lot of things on a routine basis to really make sure the treatment is exactly the way we want it. Those things include, 1, every morning make sure that the radiation that's coming out of the machine is exactly as it should be, that the special fingers that sit inside the head of the radiation machine are moving like they should, and he also then takes a model of the patient before they start their treatment, puts it under the radiation machine, delivers the treatment to that model of the patient, and makes sure what the computer said was going to happen actually happened in real life before patients get their radiation treatments.
And you had talked before how you map out like what the areas you want to treat and the areas that you don't. So for example, I know that like our machine shuts off at certain times.
Sure.
To protect that.
Yeah, so that's absolutely right. So what happens for certain circumstances, such as with a woman that has a left-sided breast tumor, there's actually an infrared light that shines off of them while they're laying on the machine. And what we're watching and what our therapists are watching behind the scenes is exactly where the patient's chest position is. And so they know what it looked like on that first day when we did that specialized CAT scan, and this computer software shows them that where their chest is on the day of the treatment is in the exact place we want it or not, and the machine turns on and off depending on the location. Now, the reason the machine does that is we know when you've taken a deep breath in, your heart is pushed further back and your lungs are expanded, and that allows us to give less radiation to the heart and more just to the areas where we want it.
That's amazing. What are the most common cancers that you do treat?
You know, I would say the most common cancers that we treat here in Port Huron are prostate cancer, breast cancer, and lung cancer. Those are some of the most common cancers that we treat nationally, and a lot of them, specifically lung cancer, can really be minimized with good healthcare decisions, primarily quitting smoking.
Right. And that's a cancer that's very important to catch early on.
Absolutely. You know, people here at McLaren Port Huron and system-wide are working really hard to start a lung cancer screening program. So those patients that are 55 to 74 years old that have smoked for longer than 30 years are now asked to get a yearly low-dose CAT scan to see if there's anything brewing before they have any problems. Kind of like when we recommend getting mammograms or colonoscopies at different age groups.
Right. Great. So what are some of the advantages for patients being treated here at McLaren Port Huron?
So there are quite a few advantages of getting radiation therapy here at the Karmanos Cancer Center at McLaren Port Huron. Some of those are brand new technologies. You can't beat the new software and new hardware that have been put in over the last couple of years. The other thing that I can't say enough about are the supporting physicians that we have in the system, as well as our nurses, our nutritionists, our speech therapists, our social workers, our nurse navigators. Really, we have a compendium of physician extenders and ancillary staff that make the experience wonderful. So as much as we can do as physicians, it's so very important to have people that care about you that provide these additional treatments and additional help throughout the course of radiation therapy and chemotherapy. You know, the other thing I can say that we have available to us here at Karmanos Port Huron that other centers in the area don't are national clinical trials. And so what we've done in the Karmanos system is we've taken the clinical trials that are available at downtown Karmanos and we found the ones that are available and important for our patients in Port Huron to be applicable for. Those are primarily studies for the head and neck cancers, for the prostate cancers, and for the lung cancers. And that really makes a difference, if not for the patients we're treating here, but for future patients across the country and across the world.
So really state-of-the-art access right here.
No question about it.
That's amazing. That's great. If people want to learn more about the Karmanos Cancer Institute here at McLaren Port Huron, how do they get more information? I
think the best things that you could do, probably Google Karmanos Port Huron. There's a lot of great information on the website. Or people are welcome to come by our department that's connected right here to the hospital. We have flyers, we have information about cancer screening, and we have a lot of staff that'd be happy to talk to them.
Dr. Bhatt, thank you so much for sharing this information with our viewers today. Very valuable for everyone.
Thanks again for having me.
So stay with us. We will continue this conversation when we return.